Hey guys, welcome back to Medical Coding with Blue. Okay, tonight's episodes are going to be fun because I have 3 episodes to film tonight. I'm going to be doing Q&A Tuesday, followed by Real Talk about the Facebook medical coding groups and my thoughts on those. And I'm going to be filming for Patreon because I have a hysterical story that happened today. If you'd like to sign up for Patreon, it's more candid blue. Obviously, there are things that I am not going to talk about on my YouTube channel, but I will have freedom to talk about on my Patreon channel. So today's episode is going to be the perfect example of that. I have supporter level starting at $1 per month, and I also have packages that include tutoring. So be sure to check it out. I'll be leaving the link for my Patreon channel down in the description box below. So let's go ahead and get started with Q&A Tuesday. All right. Lots of really good questions. Thank you guys. Thank you everybody who submitted a question. I really appreciate it because this is going to shape the questions that go on these episodes. So let's go. All right. Number 1, what pharmaceutical handbook do I recommend? There is a book called the Nursing Drug Handbook. It is available any online retailer. It's also available at Barnes & Noble. And it's just this huge thick book. And it's got all the list of the medications in it. You can also look in the appendix in the ICD-10 book. There's also, in the appendix, there's a listing of the types of medications that certain brand names fall under. So a helpful reference looking in the book. Next question. Do you have to know someone to get into the medical coding field? No. You do not. I knew nobody when I first started. Literally, I knew nothing about medical coding. I knew nothing about the field. I knew nothing when I first started, let alone knowing anybody. And anytime I've gotten a job, all the jobs that I did get, I didn't know anybody there. Okay. So no, you don't have to know anybody just to get in the field. It is going to take some persistence though. If you've seen a lot of my videos, you know, it takes more than a smile to get in, and it's going to take some effort when you're getting your first job. Okay, so next question. When do you pick up acute conditions in the outpatient setting? Anytime the patient is being treated or it is affecting their care or the provider has to assess it further, things like that. Those are the questions. Those are the conditions that you're going to pick up. Same thing with chronic conditions. If it is affecting the provider's ability to take care of a patient, say for instance, they are a diabetic and they come in because they have osteoarthritis and they need to get injections in the knees, but they can't inject a steroid into a diabetic patient unless the patient is their blood sugar is under control. Because if their blood sugar is out of control, it's going to cause steroids cause the blood sugar to spike anyway, naturally, let alone giving this to a diabetic. So that has to be taken into consideration. Those are the times you're going to be able to pick those up, those diagnoses that are impacting the patient's care, their ability to be taken care of. So that's when you would pick up acute and chronic conditions. It's going to depend on the provider's documentation as well. Obviously, if they're there for osteoarthritis treatment and the patient has hyperlipidemia, and it's noted in their medical conditions list, doesn't mean you have to pick up the hyperlipidemia if it has nothing to do with the encounter. If they're going to like the orthopedic doctor for their osteoarthritis, what does the hyperlipidemia have to do with the osteoarthritis? So consider those things when you are looking at what to pick up, okay? Because every single diagnosis you see in the note is not always going to be picked up. So something to keep in mind, as you go on in medical coding, it will start to get easier. Ask questions, look things up, okay? That's the biggest bit of advice I can tell you is to look things up. Always look things up first. I'm going to be talking about questions more later, but look things up. Do a lot of research. You have to get ready to do lots of research because it doesn't matter if you are a veteran medical coder. It does not matter if you are a brand new coder. You are going to be doing research all the time. So get used to it. All right? Just my advice on that one. Number 7, or the next one, number 7, I skipped, so. What are the requirements for evaluation and management leveling based on time? See the CPT book. If you are looking in the 2020 version of the CPT book, the professional edition, the E&M guidelines in the 2020 version is on page 7. Okay, it'll give you all the requirements for coding based on time. You can also go to E&M University or emuniversity.com. I have talked about this before on the helpful websites for medical coders. I've mentioned EM University several times for a good reference. It's EM University, for Pete's sake. So go there, look at it, and be able to do the research and find out that information. A lot of learning to do things, anything when it comes to medical coding, is your willingness to want to study and to want to research and to want to do more. You're not always going to have access to somebody who can give you the answer, okay? And you shouldn't be trying to just get the answer from just anybody, okay? If you are asking somebody, it's because you are on the fence, maybe you don't know, or it's not quite clear, but you should never just try to just go to somebody just to give you the answer. All you're going to do is hurt yourself, okay? Because you should be trying to learn this stuff on your own, okay? So, next question. Why do medical coders have production standards? To keep the ball going, okay? We have to be kept on standards because, and not all places have standards for their coders. It just depends on the size of the facility. However, when you work in a large facility and you're working with a high volume of encounters, you need to make sure that a good amount of them is being chipped away at every single day. Okay, and this sets a goal for the coder. It also keeps the coder moving forward. Not all coders are as engaged and want to go. Some have to have that. I always exceed my standard every day. I try to, at least. There's some days when I can't hit it because I'm really digging deep into an encounter, but I'll make it up. Whatever I don't do very well on that day, I'll make it up the next day. The thing about doing, having a standard for coders is so that these encounters can get touched and they can get coded and they can get done in a timely manner. This is why working with your providers to get them to streamline their documentation is so, so important, okay? Now, if you're new to medical coding and stuff that I say is not making sense right now, it will make sense eventually. So don't worry, it'll start to make sense after a while. Next question. Do providers have to meet production standards as well? Yes, they have a different type of production standard to meet. They have a goal. They have like MGMA goals. Don't ask me what MGMA stands for. Or they'll have like RVU goals, relative value units. They have to hit a certain amount in order to stay compliant. And it just depends on their documentation and what's going on in the clinic and what they're doing for surgeries and things like that. So yes, they do have their own standards of what they need to hit production-wise. It's really up to their clinic administrator what their goal is. And if a provider is not meeting their production standard, their goals, sometimes providers are punished for this. They're punished by, they can't do certain things, or they can't take time off, or they can't do certain projects, or whatever the case may be. And that's when it's up to them to come and talk to the coder if something is really going wrong with their numbers. If they feel like they are, production-wise, they're meeting what they're supposed to be meeting, and then their numbers say something else because the coder is coding it, and it's not marrying up like it should. Think about that. If your provider is not performing, or you consistently have to downcode, you really do need to talk to that provider and say, okay, let's get together. Let's, I see that you're missing some documentation here. We need to get this more clarified and things like that. And sometimes providers will fight you with this. because they don't think that they need to improve. And sometimes when they see those numbers, that's when they'll come knocking. So always be willing to accept them whenever they do finally come around. If they're resisting you at first, don't make it where they're not comfortable to come to you. Okay. And there's going to be times when they will, like I said, they will fight you, but always try to work with them regardless. If they happen to get upset, it's fine. Just go back the next day, or just go back later on and try to do a different approach. Okay. Every provider is different. Every medical coder is different. I hope that by you all coming here and doing research and listening to my my stories and my point of view and things like that, I hope that it does give you some sort of direction on things to do, because I love what I do. I love being a medical coder. I love going to work. I love what I do. I love my profession. And there's people that, give me a hard time about it. There's people that make fun of me for it. I really don't care. There's people that go to work every day and hate what they do. And I would hate that. I would hate it if I was that way. I would never want to waste my time and my life just working in a profession that I hated. Okay, which is so awesome that I love what I do. So, just some things to keep in mind. All right. Next question. How often do you have to take your credential exam? You only have to take it once, if you pass it. If you want to get other credentials later on, then you have to take a credential exam again. But once you get your credential, you have to still maintain it. You have to report your continuing education units. And don't ask because it's going to be based on the association that you are with. It is going to be based on the credential that you get. And that can be found on the website, okay? I only know about AHIMA because I'm with the American Health Information Management Association. I get a lot of AAPC questions. And I always tell you guys, go to AAPC and they'll be able to tell you. I don't discriminate on my channel. This is why I always give you guys information about both AHIMA and AAPC, because I'm letting you all make your own decision. I am not a credential snob that I just look down on other people's credentials. There are people that do that, and you will run across them in your time as a medical coder. You will run across people that will look down on you. Oh, because you have this credential, you have that credential. To me, the thing about it is it's not about the credential. It's about the caliber of the coder, because everybody is different. If I listen to half of the trash that people talk about me with my credential, no, I don't listen to any of it. It's garbage. That's why I don't do it. I don't trash talk anybody's credential. I don't trash talk any medical coding association, because it's all about the coder themselves. If the coder is applying themselves, if the coder is attempting to try to work with their providers, trying to dig, trying to do all these things to better the documentation for the provider, for the patient, for the facility, on and on and on and on, that gets my respect. Trash talking doesn't. Trash talking doesn't get you very far with me at all. So, I'm a good coder. I know what I'm doing. So that's when I hear people ignorantly talk trash about my credential. Go ahead. You have no idea. You don't know who I am. You don't know anything about CCAs. You don't know anything about other coding credentials, because if you did, you keep your mouth shut and not talk trash, right? I'm just saying. So if you have a CCA out there, good. If you have a CCS, wonderful. If you have a CPC, great. If you have a CCSP, cool. We're all awesome, as long as we are trying to apply ourselves. Next question. How How do you get prepared for a new job when you have no experience? We've all been there. Everybody had their first job with no experience. I happened to get my job at the Cancer Therapy Research Center. And working there, right, I was literally thrown into oncology, but there was a lot of other things that went into that. There's a lot of other specialties that get brought into oncology as well. So it is all about the fact that, I knew my guidelines, I knew how to apply codes. That was the most important thing. And then just after a while, it was just time with it and experience and things like that. That's what really did help. So there's really no way to prepare other than to make sure that you know your guidelines forwards and backwards. That's pretty much all I can tell you. And because they are going to expect you to be prepared to start coding as soon as you get in there. Okay, so keep that in mind. All right, the next one. Do medical coders still use coding books on the job? Heck yes, I still do. There are times when the systems will go down at work and we have to pull out the book and do it the old-fashioned way. Does it take a little longer? Yes, especially if you haven't worked with the book as much. You get a little rusty with the book, which is why I try to stay on top of actually looking up codes in the book. All of these quizzes that I give you guys that I work very hard on, I go through the book and make sure that's how I'm getting these codes. And so after a while, I try to make sure that I go through and look at them and see how fast I can go. So it really does help me whenever I'm coming up with these questions. Okay, so I'm just saying. And you always want to stay on top of working with the book anyway, because if you want to, say for instance, you get your credential and you decide, hey, I really want to continue being a medical coder, but now I want to get this other credential. I want to do this other credential or this other thing or this other thing. You still have to learn to use the book. I mean, you still have to work with the book because you're not going to be able to use the encoder when you take another credential exam. I'm just saying, you have to use the book when you sit for your exams. Okay? Next question. What do you mean when you say that book coding and real-world coding are very different? I am going to be doing an entire episode on this very question because I've answered this question quite a few times, but I don't have a specific video for it. So I'm going to do a specific video on it and answer it there because, like I said, it's a question that I have gone over quite a few times. You'll be able to know once you get out in the real world what I mean between being in the book and, doing exercises from a book and doing legitimate, like, real world documentation. So you'll see. But watch for that video. It'll be coming up soon. All right. Next question. Will employers start you in an easy clinic and let you ease in? No. I'm sorry. No, they won't. They are going to, if you pass your credential exam, you have your credential. And then you go and you take your test to work wherever facility that you want to work in. And let's say you pass that test. And now they let you in and they say, okay, great. We're going to go ahead and start you in the pulmonary clinic. Okay. You should be able to be dropped into any clinic and be able to code when you are a credentialed medical coder. You may not know all the rules right away, but you do know the fundamental basics of how to apply codes. So yes, you will be dropped into any clinic, easy or hard. I mean, there's really no way to tell. For me, orthopedics is very easy. If you ask any of my coworkers, they'd be like, heck no, I don't want to do orthopedics. I don't want to do all of that injury coding. To me, it's not hard, but there's a lot of people that see it as hard. I started out in a hard clinic, in a hard facility. Okay? I started out with oncology. That's hard. I learned a lot of things about oncology right out of the gate. I did my research. I read that section of the CPT book, all the procedures that they were applying, and I read the section of the ICD-10 book, all that section of wherever, okay, whatever clinic. I read the coding clinics, any coding clinic I can find about it. I do research on my own. I go to websites. There's a whole website video that I talk about just different websites that you can go to. So I'll try to link that in if I don't forget. But that's just my answer on that one. So you have to be prepared. Don't get overwhelmed. Everybody started new somewhere. But you're there and you're ready, whether you know it or not. Okay, so don't expect to be in an easy clinic. And besides, if you are going into a facility, there's going to be people there that have already been working there. And I guarantee you there's going to be somebody that's already in the easy clinic. Because once people get their hands on those clinics, they're not going to let them go. So this is why I tell everybody to be prepared. Prepare yourself. So that way nothing can be hard for you. Because when you prepare yourself and you're ready for anything, you're not going to want those easy clinics. You're going to want the challenge clinics. Okay? Just saying. And let's see. What medical coding credentials should I get? You know, I typed in credentials into the search for my videos. 23 videos popped up. I have 253 videos currently. 254 with this one. 23 videos popped up with credentials. If you have a credential question, 23 videos that I've done. I've talked about it. You guys have to learn to do your research. Okay? I've asked for very specific questions. Yes. I can't decide life factors like that. Like, what credential should I get? What association should I go with? I don't know, because I don't know what your situation is. And I don't know how hard you want to study. I don't know what you want to do, where you want to work, what's going to be easier for you. I've already suggested to look in your area under medical coder and see what credentials that they're looking for and go that way. I don't mind answering questions, guys, but you guys have to do your research. So that's my answer on that one. If you want to know what my thoughts are on what credential or whatever, or what school or whatever, then just type in credentials and those 23 videos will just pop right up and you can go through those videos. And I'm very clear on what is going on in that video because of the titles. So I'm going to go ahead and wrap this one up. That was it. The final question is, will another coder sit with you when you are new? Sometimes yes, sometimes no. Depends on the facility, depends on where you are. Okay, so don't expect it. You can ask questions, but make sure you've done your research first. Okay, because a lot of times other coders are not going to want to help. I'm just being honest with you guys. Okay, not everybody's like me that wants to help. Okay, there's some people out there that say, nobody trained me, so I'm not going to train you. And I think that's unfortunate. But what are you going to do? So I'm going to go ahead and wrap this one up. But if you have any other questions, let me know. If you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next video. Bye.